Well, this morning, the province's Chief Medical Officer of Health will offer the latest guidance on masking amid weeks of mounting strain within our hospital system.
Dr. Kieran Moore will reportedly recommend people start masking up. Government sources tell the Canadian Press that a mask mandate will not be reintroduced. The province lifted most of its mask mandates back in June. Dr. Moore has said he would recommend masking in certain settings if hospitals began canceling surgeries to deal with a surge of patients, which is something we are seeing at several children's hospitals.
All right, let's bring in Dr. Abdu Sharkawi into this conversation. He, of course, is an infectious diseases specialist with the University Health Network. Joins us now via Skype. Dr. Sharkawi, good to see you this morning. Is a recommendation enough considering where we are in children's hospitals and even just regular hospitals?
Well, I think it's a start, and unfortunately, I think the word mandate alone evokes such strong emotions that it's just not going to be something I can foresee happening. And I think at this point in time, what we really need is very strong messaging. We need very consistent messaging that creates a level of awareness for everyone to understand just how serious this situation has become. And not just in children's hospitals. I think we have to understand that this is an issue that is going to affect our entire community. Healthcare delivery does not happen in silos. There are a limited number of ground ambulances, air ambulances, EMT and paramedic crews. And those are going to be allocated across the community, whether it's to children or to adults. So eventually, if there is too much strain within the healthcare resource system affecting children, it's going to affect hospitals everywhere else and healthcare settings everywhere else. So if we are able to do anything to alleviate that strain by wearing a mask, by washing our hands, staying at home when we're sick, getting our vaccines for influenza, getting our vaccines updated for COVID, it's going to help. And we don't need the word mandate. We don't need something that seems like it's going to be stern and evoke such strong emotions be the way in which this is turned around.
And Dr. Sharkawi, we know that hospitals being strained, this was an issue even pre-pandemic. So now it's obviously more exacerbated. But with the current RSV and viral illnesses that we are seeing, because it came early, is there an end in sight? Will this pass, let's say, after January or February?
I think it's very difficult to predict right now. We certainly haven't seen a surge of so many viruses all at the same time. Frankly, I can't remember this in my entire career, and certainly can't remember any time when children's hospitals were in such dire situations. So I don't want to predict what's going to happen. I think what we stand to benefit from if we start really taking this serious is that we can maybe stem this tide. If people really start taking this seriously and do those very simple things, we can try and foresee what will be a much more manageable January or February. But historically, those have been very difficult months, and that's been in years where we haven't faced such huge challenges. So it's up to us. It's that simple. We can start at home and we can create an awareness everywhere we go. And if we do that, we're going to benefit the entire community here.
So how worried, how concerned are you then, Dr. Sharkawi, about what is to come over the next couple of months that typically, like you just sort of said there, January, February can be very difficult times in hospitals. How concerned are you without mandates, without, I mean, coming down to people, you and I, we all know here, a lot of people are kind of over masking, as it were.
I don't know that mandates are going to happen again, but I'm extremely concerned because myself, many other colleagues will tell you they've never been this busy in their entire career, including at the height of the pandemic when we were admitting patients to ICUs and ventilators being used for sick COVID patients. I think the difference now is it's not just COVID, it's a whole lot of other respiratory viruses, and that's piggybacking on top of a lot of people who had their care delayed, who are presenting with much more advanced disease presentations because of other points of issue within the pandemic where they didn't present for medical attention. So it's a bit of a perfect storm, quite frankly. And we need to get on top of this. I'm very, very worried about what's going to happen in pediatric hospitals. When I hear colleagues saying they're worried every single shift that they're going to see a bad outcome, that's something that just can't be accepted. And we need to take this seriously to make sure that nobody dies unnecessarily and that no more sick children or adults end up in hospital with bad outcomes. If we can do anything about it, if it's simple as putting a mask on, by all means, I think that should be something that we don't need to be coerced into doing. It's a pretty simple, I think, relatively small sacrifice to make for a system that's frankly on the brink of collapse.
It sounds like prevention is up to us individually. All right. Dr. Abdu Sharkawi, infectious diseases specialist with University Health Network. Appreciate your time this morning. Thanks,
Doctor.